Globalisation has led to an increase in migration, particularly towards Europe. Immigrant women are more vulnerable than others, often very dependent on the power of a man, and in a situation of lack of defence because they're unfamiliar with the language or the culture of the host country.
Ситуацията в България в момента като проблем се очертава това, че няма още така регулация, която да е работеща. Комисията за защита срещу дискриминацията, която е държавната институция, все още не е показала реално своите действия.
Until very recently, women with reproductive difficulties in Bulgaria had no particular rights whatsoever. And now we have special programs. We have a program that is currently helping 200 couples.
Minority women are usually invisible. They are at the bottom of a lot of social hierarchies and their needs are invisible and therefore unmet. Their voices are unheard, and even though we have welfare systems and we have health systems, they're falling through the safety net. When we look from a health perspective at some of the data on mortality, morbidity, they're living in conditions 100 years ago.
Migrant women are double discriminated because on one side they are discriminated in the country of origin. And if you look, for example, on Muslim women, then we see they have not enough rights in their countries, and they bring this discrimination with them together to the new country. And in the new country, their education, their jobs is not accepted.
Only people with a 90% loss of their capacity to work are entitled to a financial supplement. It's a bit weird, but yes, in Bulgaria, disabilities are measured in the loss in the capability to work.
Bridge building is extremely important between the EU and the local organizations, so I would plead for that. I'm sure they do lots of things and a lot of good things at this level. Somehow I would like to see it filter through to our level.
Women's participation in labor market remains unequal and with prejudice. Continuing gender gaps in terms of employment and pay we face continuous in time. Over 60% of the persons unemployed are women, most of which long-term.
Does the legislation itself create discrimination sometimes? In healthcare, for example, very often we see that men receive better attention in terms of when it comes to cardiovascular problems at a younger age, and then women are overlooked.
If you design a health policy or an economic or a labour market policy without recognising that men and women experience economy and society differently, then you have an inefficient and ineffective policy.
We believe that only the legislation is not sufficient. We know that even if the legislation is done, the implementation is also very important. We should especially have close contact with minority women by providing them education, vocational training, orientation programs in the workplaces.
We need support for women that want to continue working after childbirth. We have to see how we can improve health care. We've got to see what is happening in the other different countries, what kind of solutions are being found already, and make use of those best practices.